I'm Dr. Molly, and I injected filler into a cat's face last week. Let me show you why.
So this cat has a condition that we call entropion, which is the rolling in of eyelids, so that instead of the eyelid margin touching the eyeball, which you can see here is there's hair actually touching the surface of the eye, which causes this inflammation on the cornea or the surface of the eye. This cat is older, and this has been sort of starting to happen over time, probably just because of some structural changes in her face. And so you can see here, that is hair touching her eyeball. You can see that I have to actually physically roll her eyelid out to get to that margin. So typically what we do in a patient that has entropion is recommend surgery, where a portion of the skin under the eyelid is removed in surgery, and then when we close that incision, it does actually pull the eyelid margin back out so that that's what's touching the eyeball instead of the hair. This cat was not a good candidate for general anesthesia for a couple different reasons. So instead of doing the surgery, we injected hyaluronic acid filler into her eyelids. So here you can see me doing that. You're going to actually be able to see that eyelid tissue rolling out away from her eyeball. Here's a close-up slow-mo of it happening in real time. Very cool. So we did 2 injection sites for each eyelid. So here's the outside of this, and then the inside of this eyelid. You can see that plumping up a bit. It's a very small needle and a very small amount of filler that goes in and achieves what we're looking for here. And you can see I'm sort of spreading that filler out to help it distribute more evenly. This is the other side. Again, you can see it plumping up in real time. This procedure really just took a few minutes. This cat was sedated for it, and we applied lidocaine gel to numb the surface. There's a little bit of swelling on that left side, but this is just a couple hours later, it resolved. And now you can see her beautiful eyelid margins again, and she feels so much better already.